All right, so I have been dispatched to a 37-year-old male whose chief complaint is chest pains and shortness of breath. I went ahead and requested ALS because we are in a rural area, so if we do need to transport them to a hospital, it's good to have ALS already on the way. I also said to go ahead and have air transport on standby just in case the situation is worse than we know. Dispatch was not able to confirm number of patients, but they're reasonably sure that it is just the single patient in their house. So we're going to go ahead and go there now. As I walk in, just as a standard precaution, I put on my gloves and my N95 mask. That's what I'm going to use for BSI. All right, hello sir, my name is Griffin. I'm an EMT. What seems to be the problem today?
I got some chest pain.
You're having some chest pain? Okay. So at this point, I would go ahead and start to take the patient's vitals. So I do that. His heart rate is high, but not too incredibly out of whack that I need to immediately get him to the hospital. He responded to a verbal stimuli whenever I first came in, so his consciousness is doing okay. I'm going to check his airway. There's nothing obstructing his airway so far. His breathing is rapid. Dispatch did tell us about a shortness of breath. And his circulation, when I check his capillary refills, it is taking longer than 2 seconds. So, starting on sample signs and symptoms, he is complaining of, like I said, chest pain and shortness of breath. Sir, are you allergic to anything?
Not that I know of.
Not that you know of? Okay, are you on any medications?
I have medication, but I don't take it often.
You don't take it often. Okay. Is that medication, what's the medication for?
And it's just a heart medication.
Just a heart medication that you don't take often. Okay. Any past medical history that might be related to this?
I had a heart attack a couple years ago.
I had a heart attack a couple years ago. Okay. So, with him having had the heart attack a couple years ago and the heart medication that he doesn't take, at that point, we would probably go ahead and start to transport him to the truck where we would begin our secondary assessment. What was your last oral intake? When was the last time you ate or drank anything?
This morning.
This morning? Your breakfast this morning?
Yeah.
Okay. And what were you doing leading up to the chest pain?
I was just watching football.
Just watching football? Okay. So once we have him on the truck, we can begin OPQRST, which is the first part of our secondary assessment. By this point, I would go ahead and check his vitals again. I would assume they'd be relatively about the same. So when did the pain start?
About 30 minutes ago.
About 30 minutes ago, okay. All right, so you said you were just sitting there watching football when the pain set in. Is there anything you've done after the pain set in that has sort of provoked it, made it worse, made it better?
I tried to walk and get some ibuprofen, but I didn't make it very far.
Didn't make it very far. All right, so how would you describe the pain?
Just my heart feels heavy. I can't breathe real good, so just.
Okay. So with the patient mentioning they can't breathe real good, we would go ahead and start them on oxygen therapy, putting a nasal cannula starting at about 4 liters a minute, just to go ahead and help alleviate some of the tension that's coming from him trying to catch his breath. That's causing him to give about 24 respirations a minute, which is over and above the amount that's typically average in an adult male of his age. So has the pain moved? Is it centralized in your chest, or has it kind of moved around anywhere?
Just right here.
All right, on a scale of 0 to 10, how bad's the pain?
I say probably like a 6 or 7.
6 or 7, okay. So over time, has it gotten worse from when it started, or has it sort of maintained a level?
Kind of maintained it.
Kind of maintained a level? Okay. So at this point, we're in the truck, we're on the way to the hospital. As an EMT, we cannot assist him, we cannot give him medication, so we would simply take him to the hospital, get him checked in, and have a doctor look at him. And that's the end of this patient assessment.